it. And my body can handle it. Which would be more than this per minute going through the heart. First of all, where does it come from? If it varies with activity levels in a well-conditioned individual, for example, maybe somebody who's a marathon runner, and world-class athletes, the people who do like the decathlons and stuff like that, that liter per minute could get up to 35. How? What is happening to increase this volume of blood that's moving in the body?
Endurance.
Alex?
Probably the stroke volume increases.
But the volume, where is it coming from?
Like where's the blood coming from?
Yep.
The veins?
Do you guys remember me mentioning, veins are capacitance vessels. Meaning, they're bigger, they've got a lot of fluid in them. The more active you are, the more blood you're moving, and therefore more circulation. Because the volume, well, first of all, your heartbeat would increase. If you're going to be active, your heartbeat goes up. Some cases, people get that heartbeat up to what, like 140 or something? We'll take 140 times 70 milliliters. Do that math. Do you see where it's increasing? All right. And it's it's moving these fluids that are in the vessels of the body. So our cardiac output can vary. Under normal conditions, at rest, the body should have about 4 to 6 liters. Males are going to have more because women menstruate. And so their blood loss is more. Okay? So males will have a higher volume. Now, when we look at this resting cardiac output, and then if someone is a very well-conditioned individual, and they do their activity and so forth, and they have a maximum. Maybe their maximum is 10 milliliters per minute, based on their level of conditioning. The resting and maximum, the difference between them, is what we call cardiac reserve. Where did we just say the reserve was? In the vessels. So, our heart rate can change, the stroke volume can change, and that's going to affect the cardiac output. They can change together, like people who are very well conditioned, or they can be opposite to each other. That becomes just a tad bit of a problem. Okay? Could be physical, could be a disorder, disease, whatever the case might be. Okay? And that's going to run into some other issues for people, like fluid left behind in the tissues, for example. Okay? This is what they will take measurements for and determine the output of that person to help determine health status. So this is stuff that they look at. Well, our heart rate, we simply have ways that we take it. All right, we have pulse points throughout the body that we kind of check. When the heart rate is above 100, it's tachycardia. That could be acute or chronic. All right, bradycardia, brady meaning low. Anything below 60 60 beats per minute. Once again, can be acute or chronic. Each one can, if they become chronic issues, can lead to different problems for people. So, what else can affect my heart rate? And if it does, it's going to affect my volumes. It's going to affect the flow to it's going to affect everything. So we have what we call chronotropic effects. First, ANS, my autonomic nervous system. I keep saying that the heart is innervated, but in no way depends on the nervous system to function. Okay? And our medulla oblongata is a cardiac center. It's picking up input from a lot of areas of the body. Proprioceptors, the ones that are in the joints, okay? Baroreceptors in the arteries that branch off of the aorta. Chemoreceptors, arteries that branch. Emotions of the cerebrum, because emotions affect the heartbeat, all right? If you're upset, if you're happy, whatever the case might be, the hypothalamus will affect the heart information. That sympathetic and parasympathetic, they are innervating the heart, like we talked about before. One is increasing, one's decreasing, okay? But the two of them working together create what we call tone, and they help affect the steady heartbeat, okay? Because anything that's going to cause that heartbeat to go up or slow down is going to affect the firing rate of that sinoatrial node, because both of these fibers they terminate in the sinoatrial node. So if you have anything else that could be going on, because sympathetic is the fight or flight, your heartbeat's going to increase. Once that issue is over, then parasympathetic will kick in. But under normal conditions, the two of them are just working. We keep that sinoatrial node at a steady firing rate. Hopefully, we're good. Keep the heart rate roughly 75 beats per minute. Volume, 70 milliliters. Keep the 4 to 6 liters moving throughout the body. So that would be my nervous system affecting my heart rate. Yes, no, maybe. Now, what about chemicals? There's a lot that we do, chemical-wise. Whether we're talking about chemicals that are normal within the body, okay? Think about your norepinephrine from the adrenal gland, thyroid hormone. But then, wait a minute, what if I do something from outside the body? Okay, a lot of times, that sympathetic system gets to going, and then, you know, people be real nervous, and then finally, and they think that they're calming down, right? They might be calming down just based upon the fact that they are now focused on an activity doing something else. But what does nicotine actually do to the vessels and the heart of the body?
It increases your heart rate.
Increases my heart rate. Do you know what it does to the blood vessels to make that happen? They constrict. So your blood flow actually decreases. Caffeine, which, you know, they say caffeine is a drug, just legal. And in all reality, it is, okay? Because of its actions on the body and how it can cross that blood-brain barrier, blah, 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 okay? Then you have lots of other chemicals that you can get exposed to outside the body that are going to have effects on the cardiovascular system. Other ones, you guys hear me talk a lot about the potassiums, the sodiums, the calciums, okay? And the body is going to be keeping them in a very tight homeostatic range. The reason for that is because it affects all the muscle cells of the body, all the nerve cells of the body, okay? And heart muscle is muscle, okay? So, potassium is a major player. A lot of times in the elderly, people who may have different diseases and disorders, one of the things that can get affected is their potassium levels. Sometimes it's their sodium levels. Sometimes it's their calcium levels. Potassium, major player.
We'll be able to use that in our the question that we had.
Because this is what happens. Now, it's going to also affect the skeletal muscle and the nerve cells. But for the heart, and remember, doesn't matter what has happened, cause of death is always the heart stops. Now, potassium being a major player like it is, if we have hyper, meaning more, potassium, kalemia, okay, meaning too much potassium, it sounds backwards. You would think if you've got more, that the cells would be more excitable. But because there is so much, the cells actually don't have enough ability to react to it. So that myocardium, the heart cell itself, becomes less excitable, meaning those cardiac cells, they can't begin to contract at the normal rate, and the heartbeat will slow. Now, that's going to run into a lot of problems, okay, if it doesn't get corrected. If we have too little, which is hypokalemia, the myocardium is actually stimulated. So it actually sounds to me, which I don't know about anybody else, but to me it's like it's opposite of the way it should be, okay? Both of these require emergency treatment. People who end up having this issue right here, they know it. After it happens the first time and it almost leads to a situation of feeling like you're going to die, because really that's what's happening, okay? But if they get to the hospital, if they get it identified, if they get the problem taken care of, the next time those potassium levels get disrupted, the people know it pretty quickly because of the symptoms that come about from it. And so they usually get to the emergency medical treatment. A lot of times, if the problem can get corrected, they have to stay on medication for the rest of their life. A lot of times they'll end up having to be hospitalized, just lots of issues that come along with it. Calcium, same thing, hyper, hypo. However, it's usually rare.